Assalamualaikum.
Salam.
Hari ni kita punya grup 4A, kita akan bentangkan pasal neurogenic bladder. Jadi hari ni kita nak buat pembahagian tugas.
Neurogenic bladder ni terbentang 14 2020. So ada 4 soalan kan. So definition dan treatment tu boleh tak kalau saya nak ambil?
Boleh?
Untuk epidemiologi siapa nak? Saya.
Tasha nak? Okey.
Boleh. Sign and symptom? Boleh ambil? Kau boleh ambil?
Bila nak? Ya, symptom.
Lepas tu soalan B, pathophysiology. Siapa nak?
Kia nak?
Ya.
Okey.
Complication?
Syuna
Health advice, Akak Nabila dengan Rais boleh ke?
Boleh? Boleh.
Buat 2 orang
Dua orang. Okey.
There's a stranger in my bed. There's a pounding in my head. Glitter all over the room. Pink flamingos in the pool. I smell like a mini bar. DJ's passed out in the yard. Bobby's on the barbecue. This a hickey or bruise. Pictures of last night ended up online. I'm screwed. Oh well.
Neurogenic bladder or neurogenic lower urinary tract dysfunction is a general term for bladder dysfunction caused by damage to the nerve that control urination. Normally, the nerve and muscle of the urinary system work with the brain and spinal cord to store and release urine in a coordinated manner. Nerve damage interrupted this message, leading to a loss of bladder control.
Hi everyone, my name is Rick Matasha and my metric number is 3003. Now, let's move on to the etiology or causes of neurogenic bladder. There are several main categories that contribute to this condition. First, we have central nervous system causes. This includes spinal cord, injury due to trauma or accident or fall, which interrupts the communication between the brain and the bladder. Brain injury, stroke, or tumor can also damage the maturation center in the brain, especially in the bones or cortex, leading to bladder dysfunction. Second, neurological disorders such as multiple sclerosis and Parkinson's disease. In multiple sclerosis, the myelination of nerve fibers cause weak signal transmission, while in Parkinson or ALS, degeneration of motor controls leads to loss of bladder coordination. Third, peripheral nerve damage. For example, in diabetic neuropathy, chronic high blood glucose can damage peripheral nerve, causing bladder sensory loss and urinary retention. Fourth, congenital causes like spina bifida or myelomeningocele. This involve incomplete spinal cord development, meaning the nerve that control the bladder are not fully formed. Finally, the last one is infections and other causes. Central nervous system infections such as meningitis, encephalitis, and or syphilis can cause nerve inflammation or damage. Tumor in the brains or spinal cord may also compress nerve pathway and impair signal transmission to the bladder. So, in summary, neurogenic bladder can result from any condition that disrupt the normal nerve control between the brain and spinal cord and bladder. Next, we can move to the sign and symptom of neurogenic bladder.
Hello everyone, my name is Nur Adila Natasha binti Roslan and my metric number 240033035. Today, I will explain about the sign and symptom of neurogenic bladder. A neurogenic bladder occurs when the nerve that control the bladder are damaged, causing for problem with storing and emptying urine. Here are the signs and symptoms that may be experienced by the patient. Firstly, urinary incontinence. Urinary incontinence means the patient has difficulty controlling urination. Urine may leak out involuntarily. This happens because the bladder muscles cannot be properly controlled by the nervous system. Second, urinary retention. Urinary retention means the patient is unable to completely empty the bladder. Some urine remains inside even after trying to urinate, which can cause discomfort or infection. Third, frequent urination. The patient may also experience frequent urination, meaning they need to go to the toilet more often than usual. This happens because the bladder sends fast signals as if it is full even when it's not. Fourth, urgency. Urgency is when the patient suddenly feel a strong need to urinate. Sometimes they may not reach the toilet in time, leading to urine leakage. Fifth, stress incontinence. Stress incontinence happen when urine leak out during causing, lowing or sneezing. This occurs because pressure in the abdomen push urine out due to weak pelvic muscle. Sixth, recurrent UTI, urinary tract infection. Patients with neurogenic bladder are also prone to recurrent urinary tract infection. This is because urine left in the bladder provide a good environment for bacteria to grow. 7. Incomplete empty. Incomplete emptying means the patient feels that the bladder is not fully empty after urination. This can cause discomfort and frequent urges to urinate again. The last one, with urine stream. With urine stream where the urine flow is low or intermittent. This indicates that the muscles or nerve controlling urination are not functioning properly. That's all from me.
Alright, now let's talk about pathophysiology of neurogenic bladder. My name is Nur Kiasatina Najwa binti Syajahan. My matric number is 24003034. Now I will talk about the pathophysiology of the neurogenic bladder. Neurogenic bladder happen when the nerve in the brain and the spinal cord that control the bladder are damaged. Normal bladder function is when the brain and the spinal cord nerve work together. When the bladder is full, brain will send the signal to the bladder, and then the bladder will contract so that the sphincter will relax. Then the urine will flow out. When storing any urine in the bladder will remain relaxed so that the sphincter will remain closed. When there is a damage in the nerve, the signal between brain and the bladder is interrupted. The bladder and the sphincter that doesn't work in coordination anymore. This will cause the main problem, which is urinary incontinence, di mana berlakunya leakage, and then urinary retention.
Alright, so let's move on to the complication of neurogenic bladder. When our bladder doesn't function normally, it can lead to a short-term and long-term problem. So let's go through them one by one. The first and most common of complication is urinary tract infection, or we call UTI. When the bladder doesn't empty completely, urine stays inside, and that creates a perfect environment for bacteria to grow. Patients often feel burning during urination, fever, discomfort in the lower abdomen. Next is reduced quality of life. Many patients feel embarrassed or anxious because of urine leakage or the need to use catheter. This can affect their confidence and make them to avoid social situations. Another common problem is interrupted sleep, or we call nocturia. They often have to wake up many times to urinate, which causes tiredness and affect focus during the day. Skin irritation can also occur due to frequent urine leakage. Skin irritation, especially around the groin area, can become red, sore, or even develop small wound. And lastly, pressure sore. This usually happen in patients who sit or lie down for long hours, or we call CRIB. CRIB stands for complete rest in bed. When combined with moisture from urine, the skin becomes weak and easily damaged. Now, let's look at the long-term complications. These are usually more serious. First, there's a higher chance of developing kidney stone. Because urine stays too long in the bladder, mineral can collect and form stone, which block urine flow and cause pain. Second is urinary retention. The bladder muscle may become weak and can push urine out properly. This increases the risk of the infection and pressure will out. Third is kidney infection, also known as pyelonephritis. This happens when bacteria from the bladder move up to the kidney, causing high fever, back pain, and in severe cases is sepsis. Fourth is vesicoureteral reflux. This is when urine flows backward from the bladder into the kidney. It increases pressure inside the kidney and can eventually cause kidney damage. If the pressure continues for a long time, it can lead to scarring and deterioration of the urinary tract and eventually kidney failure. When kidney failure occurs, the kidney can no longer filter waste and extra fluid from the body. At this stage, patients usually need dialysis treatment to survive. Without dialysis or kidney transplant, the patient condition can become life-threatening. Other long-term issues include worsening incontinence, where patients lose more control over urination and dependence on catheter to empty their bladder regularly. So, in conclusion, neurogenic bladder can cause many complications, ranging from mild infection to serious kidney failure that may require dialysis. That's why early management and regular follow-up are very important to prevent long-term damage. With proper care such as catheterization, bladder training, and medication, most of these complications can be avoided. Thank you for listening.
Now, I'm going to explain more about treatment for neurogenic bladder. The first approach is pharmacologic therapy. The main goal are to control bladder overactivity, improve bladder emptying, and reduce sphincter tone. Anticholinergic drugs such as oxybutynin and tolterodine help relax the bladder muscle. Betanicol, which is a cholinergic agent, helps stimulate bladder contraction. Alpha blocker like tamsulosin or doxazosine help relax the urethral sphincter to improve urine flow. In some cases, botulinum toxin or Botox is injected into the bladder wall to reduce overactivity. The next approach is non-pharmacologic therapy. First is bladder training. We teach the patient to empty the bladder at regular intervals. Second, clean intermittent catheterization or CIC, which is used to regularly empty the bladder and prevent infection. Third is some patients may need an indwelling or suprapubic catheter for continuous drainage. Last is pelvic floor exercise such as Kegel exercise to strengthen the muscle that control urination. For patients who don't respond to medication or training, surgery may be required, like sphincterotomy, which is done to relieve obstruction caused by a tight sphincter. Next is bladder augmentation, which increases bladder capacity by using a piece of intestine. After that is urinary diversion, which creates a new route for urine to leave the body. And in some cases, an artificial urinary sphincter can be implanted to control severe incontinence. That's all from me.
Hi, my name is Nurul Nabila binti Ruzi and my metric number is 23003075 and I will talk about health advice for neurogenic bladder. First, ask patient to do daily pelvic or Kegel exercise regularly. Why is it important? Because it can help to strengthen your pelvic floor muscle. Your pelvic floor muscle is the set of muscle you use to stop the flow of pee. So if you strengthening this muscle, it can prevent you from leaking the pee or passing gas or poop. It has benefit for people who has urge incontinence such as like urinary incontinence or fecal incontinence. Also, this exercise can also help improve your health and improve your organism. So everyone can get benefit from this exercise. Okay, so how to do this Kegel exercise? First step is you need to lie flat and then bend your knees like at the first picture, and then you must locate your pelvic floor muscle. And then draw your pelvic muscle up and in. It should feel like you holding a pee or like you're pulling your genitals up and in. If you don't understand, you can review this video how it should do. And then you must tighten your pelvic floor muscle for about like 3 seconds and then relax them for 3 seconds and then do it again for like repeat for like 10 times. Now the second is do the right exercise. High impact and sit up can put pressure on your pelvic floor muscle and it can lead to leaking of pee. So to strengthen your pelvic floor muscle, you need to replace high impact exercise such as jogging or aerobics, plus with strengthening exercise such as Pilates. Pilates can strengthen your core muscle, which can beneficial for stress incontinence. This Pilates is very easy to do at home and it doesn't cost much money to do it. You just need to have mat and the dumbbell. That's all. Next, you must ask patient to avoid having lifting. Lifting weight can put pressure on your pelvic floor muscle. So you must avoid it whenever you can. When you need to lift something like pick up your children or shopping bags, you can tighten your pelvic floor muscle before and during the lifting. Number 4 is advise patient to do bladder training. Bladder training can help you stretch out the time between each trip to the bathroom. So, to do bladder training, first you need to have a small notebook or what kind of notebook you like to record it every time you want to go to the bathroom, not the time when you urinate and any fluid you drink. This will help you to understand your current patterns and average time when you go to the bathroom. Then create a schedule to increase the time between bathroom visit, starting with an interval 15 minutes longer than your current average. When you feel the urge to urinate before your scheduled time, use technique like deep breathing or pelvic floor exercise, or you can distract to hold it from pee, such as go walking around the neighbor or reading some books, or you can do your chores at home so until your next scheduled trip. After a few weeks, you can gradually increase the interval by 50 minutes each week until you can comfortably wait for 3 to 4 hours between urination during the day. Next, wear absorbent urinary pads or underwear. This product can catch any liquid pee, so you can usually wear them under your clothes without anyone noticing. Next, wear absorbent urinary pads or underwear. This product can catch any liquid pee. And number 6, educate patient to do vaginal insert. It is an over-the-counter device that you insert into your vagina. It can compress your urethra and help to reduce your stress incontinence. It has many types of patisserie. First is ring type. Ring is for mild first-degree uterine prolapse or for a cystocele. Next is cube type for second or third degree uterine prolapse. This cube need to remove every each night. Next is donut. Donuts for third degree prolapse and cannot be deflated during insertion or removal. Next is ring with knob for straight urinary incontinence. And then for this type, for straight urinary incontinence will mild prolapse, while short type for mild prolapse complicated by a mild cystocele. And lastly is gel horn for third degree prolapse.
My name is Ahmad Rais Aiman bin Ahmad Fuad. Matrix number is 24003080, and today I'm going to talk about health advice. Now, first is to maintain a healthy weight. Losing excess weight reduces pressure on the bladder, which can decrease stress incontinence and frequency. Secondly, practice good hygiene or catheter care. If you use a catheter, ensure a strict sterile technique and consistent cleaning to minimize the risk of UTIs. Or another words is urinary tract infections. And the third is avoid smoking. Stop smoking because it is a known bladder irritant and can increase the risk of bladder cancer. Fourth is monitor for urinary tract infections. Be aware of urinary tract UTI symptoms such as cloudy, bloody, foul-smelling urine, fever, flank pain, and report them to your doctor immediately, as early treatment is crucial. Fifth, discuss all medication. Review all your prescription and over-the-counter medication with your healthcare provider. And as some drugs like non-steroidal anti-inflammatory drugs and SAIDs, antihistamines or diuretics can affect bladder function. The examples such as Benadryl, chlorotrimethine, ibuprofen, naproxen. That's all from me. Thank you.
Hope you do have money.